box means. So scroll down till you find shelter box needs. That's it. September 30th, 12 o'clock. That's it. Passcode, copy that if you need it, and then join that Zoom meeting.
I think Kelly has a future in air traffic control.
Okay, bye. Funny.
Very good.
Hey, Kelly,
That was
getting
good.
the world in order.
Just Patty, Toronto.
You know, after I looked at it, I thought I should have put that link at the top, and then I
Yes.
but it's the way my brain works. I start from the top and I think, okay, what's this order?
Yeah.
The thing is, you'll notice it came on about 12:45 last night. It was like, oh, I was so done.
Yeah.
Like, get this thing done.
Well,
Oh,
thank you for what you do, Steve, because we do know there's a lot that goes in behind the scenes that we don't see.
Hey, Valerie, I
Yes.
have to ask you, I tried to get on this tiny ARPA survey.
Uh-huh.
Uh-huh.
Yes,
It's
and
not
it
letting me on.
okay, well, that's what I wanted to hear because I was actually going to announce that because everybody should get it in the mail. So I will troubleshoot it and make sure that
Will you please,
I think
because it's not letting me in.
okay, you can also, I think, get it on the city's website, but I haven't, like I said, I haven't tried it yet. So,
Okay, I'll try the city one next.
Yeah.
I tried the city one first and couldn't find it on the city website. And then I reread the letter and there was a different
Yeah, the tiny one.
different email address than the one I was trying. And it goes to a survey thing.
It's a
And there's
survey
a-
for
and
ARPA
there's
funds.
a
I'll talk a
special-
little bit about it. I had the
Okay.
piece of paper
Yeah.
here.
There's a
But we'll
special
talk about it.
code you have to use.
Yeah, I couldn't even get to that point.
Yeah, did you go to tinycc/GPHA ARPA?
I did.
well, we'll hold
Well-
that for the Valerie section of the meeting, and we're going to kick this meeting off because it's
Yes.
12:02. Okay, so I'm going to let's see. We'll start with the fire horn. Got it. Okay, so we're going to mute everybody. Okay. Well, welcome to Rogue Gateway Rotary, the end of a month, the end of a quarter, September 30th, and welcome. So, Valerie, would you like to start us out with the pledge, please?
I will.
Thank you.
All right. Do we have a flag or are we just pledging and moving forward? Pretending.
Let's pretend.
Let's pretend. Okay, I'm always a good pretender. Okay. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, thank you very much. And for our inspiration today, Cindy Crondall.
Okay. I always notice when in my life when challenges seem to show up that anyway, I just always like those little powerful words. So here's it's a little bit long, but not really. So this is 8 powerful words for the day. Number 1, believe in yourself, believe you can and you will. Number 2, stay strong, dream, believe, achieve. Never give up. A little progress each day adds up to big results. Number 4, be grateful. A grateful heart is a magnet for miracles. Number 5, hard work. Good things come to those who hustle. 6, stay humble. Work hard in silence. Let success make the noise. Number 7, be kind. Kindness makes you the most beautiful. And 8, keep smiling. Because of your smile, you make life more beautiful. So there you go.
Well, thank you. Those are appropriate words for today. and every day. Thank you. Do we have any visiting Rotarians or guests today? I would say I will introduce two guests today that I have in honor of our program, four-legged friends. So Hope and Finn are here with us today in honor of our animal shelter presentation.
And Steve, I have a guest today, Laura. How do you say your last name, Laura?
It's actually changed since how it's written, and it is now Jansen.
Oh, okay. Well, is that a congratulations?
Yeah, it's 2 years of very slow name change processes with all of COVID closing the offices. So yes,
All right.
delayed congratulations. Thank you.
Well, Laura is here and she'll be our presenter today, and she represents those four-legged beauties that you just saw a moment ago.
Okay, thank you. Any other guests?
And there's another guest.
Yeah, I have.
Yes, Judith.
Go ahead.
Judith is here with us again. She was a former member.
Welcome.
hear
Judith.
me?
Yep,
No.
you did. We're good. Yep, thank you. Welcome, Judith.
Good.
And then I would want to basically say that one of our guests also is Dr. O'Keefe, who is the Deputy Health Administrator for Jackson County Public Health. She's going to be giving us a healthcare update. She's been here before. I think we should see if she wants to become a member. So we'll keep working on her, but she's going to give the update here in a couple of minutes, and welcome to her being here again today.
Okay. And Tim Lemons, this is a second posting for membership. He's on the call today. Welcome, Tim. Okay. Well, for our Rotary Minute, I thought I would finish up more interesting facts about Rotary. The largest Rotary club is the Oklahoma City Downtown Club with over 600 club members. During the 1920s and 1930s, Paul Harris traveled extensively and he ceremoniously planted trees to symbolize goodwill and friendship. My dad would have appreciated that visit. In 1934, Boys Week became known as Youth Week, and in 1936, Boys and Girls Week. Rotary's fiscal year began the day after its conventions in 1913. Starting in 1913, it begins on July 1st. Regards to Polio Plus, in 1988, Rotary began the Polio Plus campaign with an initial fundraising pledge of $120 million. And providing vitamin A supplements during the polio immunization has averted an estimated 1.5 million childhood deaths since 1998. The plus in Polio Plus. So we ended on health. Wynn, do you want to take it away as far as the healthcare minute, please?
Yeah, so like I said before, we have Dr. O'Keefe. She's agreed to kind of give us an update on a couple of things that's really important. And I'm so grateful that she's willing to spend a few minutes with us this afternoon. And I also want to say thank you to our club. I really want to say from the bottom of my heart, I'm so thankful for all that you're doing around Operation Gratitude. I know all of our employees are so appreciative of that. And so your act of love and kindness is really, really amazing. So thank you. And I'll turn it over to Dr. O'Keefe.
Okay, well, thanks for having me back again. I will get my screen to share here. Okay, you guys should be able to see that. So a little bit of an update on where we are with COVID, and then Wynn asked me to share an update on vaccines in terms of the new boosters that have been approved recently. So these are general numbers for Josephine County through Saturday, and you can see new cases, we've had 191. If we compare to the last time I was here at the end of August, at that time we had 775 new cases in a week. So we've definitely dropped down, which is great. Our total deaths are up to 192 compared to 123 last time I saw you. And the vaccine rate is going up. So last time I saw you, it was 53.5% of everyone age 18 and over. And we are up to 56.8%. So we're slowly making our way there. This is a graph of Josephine County's COVID cases over all time since COVID started. And obviously this surge that we just had from Delta is by far and away the worst we've ever had, but it is coming down and we are so grateful for that. I would point out that right now we are right about where we were during the peak of our surge last winter when we thought things were pretty bad. So even though we're coming down, we haven't yet gotten to where we want to be. So please don't stop wearing your mask just yet. And please don't stop encouraging friends and family members to get vaccinated just yet. We still have some more work to do, even as we are making progress. Our hospitalizations, this top line is for Josephine and Jackson County people hospitalized with the diagnosis of COVID. And obviously that number is coming down dramatically. The last couple of days it's increased, so keep an eye on that. The second line is people in the ICU, and the bottom line is people who are ventilated on a breathing machine. So across the board numbers coming down, the severe cases in ICU and ventilated is staying stable. And that's because those people tend to be sick for longer. So we would expect that number to come down more slowly. This is a very simplified graph of deaths that we have had. And obviously August was the most that we have seen so far. September is close behind. It's the last day of September, but we do get reports of deaths a few weeks out sometimes. So we'll see where we end up there. Just a reminder that Asante does post their numbers every day, and the website is listed there for you. Unvaccinated are represented by blue, vaccinated in orange. So, oh, I apologize. I did that backwards. Unvaccinated is orange, vaccinated is blue. So the point is that people who are vaccinated are much less likely to end up in the hospital. Not impossible. No vaccine has ever been perfect, but it certainly brings a good layer of protection to get vaccinated. And in Josephine County, we can see similar to the rest of the state that as the surge went up and our cases of COVID went up, so did vaccination rates. Now that the surge is getting quieter, so are vaccination rates. So I think as people have personal experiences with COVID, that tends to urge them on towards vaccination. Okay, so before I get to the most recent type of vaccine approved, I thought it would be helpful to talk about third doses. And there is a difference in terms between third doses and boosters, even though they're both the third time someone might be receiving a vaccine. So third doses are approved for both Pfizer and Moderna. And these are intended for people who are moderately or severely immunocompromised. There's a list of examples there. And what this means is after 2 doses, those individuals probably didn't get a really robust response to their first doses the way other people do, because their immune system isn't as strong. And in order to get them up to that nice high level of protection, they actually need a third dose. So that's what these are for. And the third dose can be given about a month after their second dose. What was approved just this last Friday are boosters, and only for Pfizer, not for the other vaccines yet. Boosters are intended for those who had a really good response to the first 2 doses, but over time, their protection has gotten weaker. And this happens with a lot of vaccines. That's why kiddos will get 5 tetanus shots in a row as kids. It's just reminding the body what the virus looks like so that it can maintain that same high level of protection that it already had after the first 2 doses. It is fairly complicated the way they've set it up on who qualifies for these. If you're over 65, we want you to get one. If you or someone you know live in a long-term care facility, we want them to get one. And then on that upper age, 50 to 64 with underlying medical conditions, we want you to get one. And the reason those really should get the boosters is because those are the people who we're seeing are vaccinated but still end up in the hospital, as you saw from Asante's snapshot. Other people who can get them are younger people with underlying medical conditions, and basically any chronic condition qualifies. If you work someplace and you're on the front lines and you're maybe frequently exposed, if you're a teacher, you're a healthcare worker, you're a grocery store worker, you can go ahead and get a booster. Those can be given 6 months after your second dose, at least 6 months out. If it's more than 6 months, it's okay. Your body still responds. Moderna and Johnson & Johnson have not been approved for boosters yet, but please don't stress about that. To this point, the only vaccine that has had some decrease in efficacy is the Pfizer. And that may just be because Pfizer started to be given soonest. So it has had more time for its efficacy to wane or for it to get weaker. We may see that with Moderna and Johnson & Johnson, but we haven't yet. So I encourage you to wait patiently and confidently knowing that you are protected. And in particular, you're very protected against hospitalization and death, which are the main reasons that we have these. I missed a really important category for the boosters. Those who have traditionally not been able to access healthcare and have some vulnerabilities there, that group also can get a booster. If you have a lot of questions about this or any questions, this website is really helpful by OHA. It helps differentiate boosters and third doses. So please feel free to visit that. And then the last thing I would plug again is monoclonal antibodies. If you've been exposed or you've been diagnosed with COVID and it's been less than 10 days and you're not hospitalized, this treatment prevents up to 70% of hospitalizations. Not everyone qualifies, so you want to talk to a healthcare provider to see if you qualify. You can call the Asante COVID hotline or the Josephine County COVID hotline and get guidance there. And we can connect you for vaccines, for testing, or for monoclonal antibodies. So I'm happy to answer any questions about that. There certainly has been a fair amount of confusion. I think with time in the next few weeks, Moderna will also be approved for boosters, and it will be probably much less confusing at that point.
Okay, thank you very much, Dr. O'Keefe. There is a question in the chat. It says, I read a New York Times article that said that the Moderna vaccine was proving to be the most effective as time goes by. Have we seen that locally?
Yeah, I would agree with that. And it's been a few weeks since I calculated out all of the numbers, comparing, oh, it looks like someone's gotten Moderna as they're doing a happy dance. I have broken it out in the past to compare breakthrough infections of Pfizer versus Moderna versus Johnson & Johnson. And for our area, that has also been true. Moderna has held strong. There's a couple reasons that may be true. Moderna started later than Pfizer, so we haven't had as much time go by. Also, Moderna used a higher dose of the mRNA than Pfizer, and so that may be part of it. And also, Moderna is spread by 4 weeks rather than 3 weeks, and typically for vaccines, waiting a little bit longer for an extra dose leads to a higher response by the body. So that may be why Moderna has been holding out stronger.
Thank you very much. Any other questions?
Excuse me. Oops. Hello. I don't know how to.
I can hear you.
I have I couldn't figure out. I can't find the chat thing. I've got something wrong with my computer here. But I'm Judy Ano. I have a question that's unrelated, but I'll keep it quick then. I know you do clinics for businesses, organizations, schools, events. I'm thinking the air show, if anybody has context, or you're already not, maybe you're doing that already, but what are you looking at with the organizations? Are you looking at kind of a minimum number of employees? And also, what's the best phone number to call?
I don't think we have a minimum number of employees because we're excited when a single person gets vaccinated because that makes a difference.
Mm-hmm.
We are looking at the air show. I do have your most recent email on hand and I haven't, it's been a little bit of a chaos.
I know.
For some reason, even though COVID numbers are going down, life is getting more chaotic in the world of public health.
I know.
But just calling the main Josephine County Public Health line is fine. We have a vaccination team that they would get directed to, and we meet once a week to talk about new and fresh ideas. And yeah, we're always open to those ideas.
So they just call the main number and say, I'm interested in an on-site clinic, or I have an
Yep.
event. Okay,
Yes.
got it. Thank you so much.
Yeah.
Tommy, you have a question.
His husband actually has another question. I've had my COVID shots 6-7 months ago. I'm wondering if you can explain in terms that us non-medical types can understand why you can't get a COVID shot right after you find out that you've got the disease. Is there some reason?
Great question. The reason is to protect the person giving you the shot. So if you've just recently been diagnosed with COVID, you may be shedding the disease, and we don't want to infect other people. There is no safety concern. If I'm diagnosed with COVID today and I get the vaccine in 2 days, it's okay for me to do that. There's nothing dangerous that could happen to me for getting the vaccine. It's just we're trying to protect the healthcare workers who are actually providing the vaccine.
Well, thank you.
Yeah.
Valerie, you have a question.
I do have a question. It's more to do with the testing. One of the things I read about in other countries that they've put a lot more into having rapid testing, and that allows people who may not be feeling well or may to do a rapid test so that they don't go out, because a lot of people, you know, especially now, are all so paranoid, and you sniffle and you think, oh my gosh, could it be? So that's one of the things that other countries have put a lot of money into, and we have not. Is there a reason for it, or is there a way we can help promote that more?
Yeah, I also have been reading about that and very interested, and have been talking about that at the state level. Ultimately, we would need some pretty big changes to happen at a federal level in order to do that. So part of the reason that hasn't taken off is because the US has been much stricter about what kind of tests have been approved for use. So we only have a few tests available, whereas other countries have dozens of tests available. And obviously that comes from a good place, a good intention, but it has meant that there are more limitations in getting the tests out there. I believe President Biden has plans to get more tests available. And I know our local county commissioners would like to get more home tests available. I think it really comes down to a limit in the number of tests. And right now, we have state guidance that we can't use tests just for screening purposes. And that's because of how their contracts are written with the federal government. So again, we're talking about some really high level changes that need to occur. I've heard some pretty neat stories. You know, you want to go to that concert or go sit in the restaurant or go to that baby shower. So you take a rapid test. And if you're negative, there's no guarantee you won't have COVID disease in 3 days. But if it's negative right then, you're pretty low risk for spreading disease right then. Now, negative tests are more likely to be incorrectly negative than a positive test. If you test positive, almost guaranteed that you've got COVID. If you test negative, there's still actually up to a 30% chance that you do have COVID, and we just don't know it based on that one single test. So there is a little bit of risk involved there, but certainly would make it easier, I think, for people to go out and do the things that they enjoy in life without being fearful that they may be spreading disease. So I agree with you, but it's above my level of change impact. So keep talking about it.
Okay, thank you.
Patty Toronto.
Hi there. Can you tell me what the difference is between the booster and a third vaccination? What's up?
For Pfizer, there is no difference in the actual vaccine itself. It only has to do with who is receiving the vaccine. So a third dose is aimed towards those with moderate to severe immunocompromise. A booster is aimed at all of the other many categories we mentioned. So at this point, since third doses and boosters for Pfizer are both approved, it's really a wash. Moderna is a bit different. For their third dose, it's the same dose as the first and second doses for immunocompromised people in order to get them up to that same high level of protection. The booster for Moderna, however, will be a smaller dose. And so that will be geared towards people who already had a good response, but just need a reminder to their system. So, yeah.
Cindy, you have a question?
Yes, hi. My question basically goes back to the testing. I'm really confused. I had to have emergency surgery the beginning of September. And of course, you know, I came in through the emergency room and they had to do a COVID test. Well, my test came back negative, but they said I was presumptive. So isn't, you know, there, I don't understand when it says we have this many cases, it's cases plus presumptive. Isn't that kind of a I mean, I want to understand that because to me, that doesn't sound like that's really given the real deal. Because I didn't have COVID and I know I don't because, you know, it's been 3 weeks. So anyway, can you explain that?
Yes. Yeah. So we have kind of 3 different categories. We have confirmed COVID cases, presumptive, and suspected. And so confirmed, you have a test that's positive, you've got symptoms, you were exposed, all of these things are lining up. We can be certain you have COVID. Presumptive, there are a variety of ways to meet that definition, and they just changed it this week in our new guidelines. But you could have classic symptoms for COVID and not have a positive test, but we know you've been exposed in the last 2 weeks. So you had exposure, you have symptoms that are really classic for COVID. We're not finding anything else to explain why you're having these symptoms. So then you're a presumptive case.
Okay.
Suspected is like, oh, maybe you have it. We don't really know yet. So that's kind of the weakest. And those are not counted in the overall numbers.
Okay.
Suspected means you might have it, but we need to get some more information to figure out whether or not you have it.
Because it just seems like when you see the number and it says "am presumptive," it's like, well, how many were really infected and how many were presumptive? I don't know.
I will say that outside of public health, me included, before I entered the world of public health, there's a lot of confusion around these definitions.
Yeah.
And so presumptive, suspected, and confirmed, there's confusion around that. Even the difference between quarantine and isolation, there's confusion. So, you know, not knowing all the details of your personal medical history,
Sure.
I wonder if somebody used that term maybe without knowing the strict guideline definition for it. That's a possibility. Or maybe they, you know, you were exposed and you were having some symptoms that may have fit with the category of that. But
okay. No, that makes, I just always wanted to know and nobody could explain it to me. It's like, so anyway, thank you.
Yeah. Glad you're okay.
Debbie Brownell.
So I was told by a healthcare professional that if a person had COVID and then had the first and second vaccines, that they should not get a booster. Is that legitimate advice?
I have not heard that. That's the first time I've heard it. So I tend to take my information mostly from CDC and OHA, Oregon Health Authority, and I have not heard that mentioned.
All right, thank you.
Yeah. I can't, you know, thinking through the pathophysiology, I can't think of a reason why that would be. And not having heard that from higher levels, I don't think
she said
true.
it would decrease immunity.
No. Oh, no. And in fact, there are studies that have shown if you've been infected with COVID and go on to get vaccinated, you're like super protected compared to everyone else. So it actually very much boosts your immunity. It doesn't drop it.
All right, thank you.
Yeah.
Question from me. How much contact tracing is going on currently? I know it
Ah.
was really a big thing. And what is the current status of that?
Yeah, great question. That has changed week by week as our caseload has changed week by week. So when we were at the peak of the surge, there was basically no contact tracing going on. We couldn't even contact all of the confirmed cases of COVID that were being reported. So people were receiving letters. We were trying to differentiate high risk from low risk and at least contacting high risk by phone. And then others were just getting letters and text messages with information, and they had our phone number. So if they had questions or concerns, they could always call us and we would respond to them. So contact tracing specifically means figuring out who's been exposed to COVID and letting them know they've been exposed and what to do with that. And so we are now almost back into our full mode of being able to do contact investigation, care for people who have confirmed cases of COVID, as well as contact tracing, contacting people who may have been exposed to COVID and letting them know what to do. So we've also been hiring more people through this surge. So we're just about back at full capacity now.
Okay, thank you. Kate.
Hi, Dr. O'Keefe. Thanks so much for being on my
Kate.
radio show. Hi.
Oh, it's my first time seeing your face.
Yeah, we've spoken on the radio a lot on my radio show. That's why I made a point of changing my name from the four-way name for this meeting, so you could find me.
Yes,
But,
fabulous.
My question is, back in February of 2020, a lot of people in our community had the cold from hell, and it went around, and a lot of people are convinced that they had COVID at that time. Has there since then been any investigation into that particular illness? Do we know if a bunch of people who had it came up with COVID antibodies? The antibody testing was something that was happening earlier on. Have we ever been able to shed any light on the likelihood of whether that was early COVID or not?
No, and I doubt we ever will be able to. So the trick or the problem right now is, how do we measure that? So the easiest thing we have available to measure are antibodies. It's a blood test, you measure the antibodies. If you have antibodies, it tells us you've been exposed at least. It doesn't guarantee you were infected, but you at least have been exposed. But a lot of people, their antibodies go away even after infection, and yet that doesn't mean that they don't have protection, because we have other cellular immunity, T cells and B cells and things that also remember the virus and keep us protected even if the antibodies are gone. Measuring T cells and B cells is a tricky thing, and sometimes even involves bone marrow biopsies. So that's why we're not going that far with it. But without a doubt, we know there are far more people who have been infected than we are aware of, because lots of people have had infections and didn't get tested, and so we just don't know. And I will say that more and more, the state is trying to look at natural